The Veterinary Feed Directive has been and will continue to be an important part of regulating how we feed our animals, but it is something that most people are not aware of. In 1996, Congress passed the Animal Drug Availability Act, or ADAA. Before this act, there were only over-the-counter and prescription drugs available for livestock. Under the ADAA, they created the category called Veterinary Feed Directive Drugs, or VFD. The purpose is for this regulation and oversight of antimicrobial drugs, as there is concern about human consumption of animal food products contributing to the resistance of antimicrobial drugs.
VFD drugs are drugs for use in animal feeds and must be used under the supervision of a licensed veterinarian, and the files for the VFD must be kept on record for at least 2 years. These are new changes that have occurred as the result of work conducted over the past few years. The veterinarian must indicate an expiration date for the product. Additionally, the veterinarian must have a long-term professional relationship with the producer. New drugs are submitted to the Center for Veterinary Medicine for categorization as an over-the-counter, prescription, or VFD drug.
The use of most ionophores, like monensin, as well as many coccidiosis medications, will not change. This is because they are not often used in human medicine. Injectable antibiotic statuses have not changed, but water-fed medications are now prescription status. This is a change from their current over-the-counter label. Feed mills and distributors will still be able to supply these products, but there will be more paperwork. The full implementation of Guidance 213 will occur in December 2016. After this point, it will be illegal to use any medically important antibiotics for the purposes of production. All producers will be required to obtain authorization from a licensed veterinarian and can only be used for the prevention or treatment of a specific disease. Currently, each of the 25 drug sponsors that will be affected have committed to adhering to these changes.
The role of veterinarians in livestock production will continue to be very important. The VFD may encourage closer relationships with veterinarians, which could help improve the efficiency of use of these products. While the new VFD rulings are aimed at limiting the amount of antibiotics in animal diets, it is important to note that there are currently no antibiotics in animal food products. Every medicated feedstuff is regulated by the FDA and has a withdrawal time on the label to ensure that there are no traces of antibiotics in your food.